Medical marijuana and epilepsy. The verdict is still up in the air. The push for medical marijuana in today's society is at an all-time high. One of the areas of medicine where marijuana is being implemented is neurological disorders. Epilepsy is the fourth most prevalent neurological disorder in the United States, and it is well known for causing recurrent, uncontrolled seizures. Previous research has suggested that the use of cannabinoids, specifically cannabidiol, CBD, alleviates some of the seizure-like symptoms of epilepsy. Medical marijuana and epilepsy. The verdict is still up in the air. The push for medical marijuana in today's society is at an all-time high. One of the areas of medicine where marijuana is being implemented is neurological disorders. Epilepsy is the fourth most prevalent neurological disorder in the United States, and it is well known for causing recurrent, uncontrolled seizures. Previous research has suggested that the use of cannabinoids, specifically cannabidiol, CBD, elevates some of the seizure-like symptoms of epilepsy. Positive effects of marijuana on animal models with forms of epilepsy have been studied since the 1970s. Although there are a lot of potential benefits circulating this topic, there are many uncertainties when implementing marijuana in a medical situation. One of the difficulties with medical marijuana usage is using the proper dosage. The proper dosage of marijuana is still a gray area, partially due to the various ages, tolerances, and body masses that all must be taken into account. Another factor is the variability within the marijuana industry. Producing marijuana with the same percent THC, CBD, and same quality can be challenging. Medical marijuana is only legal in 29 states, which makes conducting sufficient amounts of research more difficult. Besides some of the positive effects marijuana has shown to have with epilepsy, marijuana use has also been suggested to have negative effects on memory and brain development. One of the difficult questions within this topic is whether medical marijuana should be used on children with epilepsy. Significant amounts of research have shown that marijuana use as a teenager or adolescent stunts brain development. At this point, medical professionals must assess whether epilepsy or stunted brain development is more detrimental to the child. A statement from the American Academy of Pediatrics, or AAP, in 2015 listed some of their stances on this topic, including opposing marijuana usage in children and adolescents, recognizing marijuana use in desperate situations, and opposing the method of smoking marijuana. The potential for medical marijuana being used in the treatment of epilepsy is there. There have been several studies that suggest marijuana helps alleviate the seizures that are associated with epilepsy. However, the knowledge surrounding marijuana use in a medical context is still fairly unknown. There are many factors that make it difficult to ensure the quality of many of the studies that are currently being performed. It is my prediction that within the next several years this topic will be explored extensively and the medical community will reach a verdict on whether marijuana is a viable treatment option for epilepsy and many other neurological disorders. As for now, the verdict as to whether medical marijuana safely helps with epilepsy is still up in the air.